What happens when skincare alone isn't enough? When acne is persistent, inflammatory, or keeps relapsing, this is where aesthetic treatments and advanced management strategies come into consideration. Today, I want to explain when procedures actually help acne, when they don't, and how clinicians think about combining treatments without destabilizing the skin. So, not all acne responds fully to cleansers and leave on treatments, even when those treatments are actually appropriate. This is often seen in persistent inflammatory acne, acne that flares cyclically, acne associated with ongoing redness or early textural changes. So, at this stage, skincare alone may control symptoms, but not fully shift the underlying behavior of the skin. This is where aesthetic treatments come in, but it's important to understand something. Aesthetic treatments are not a shortcut. They're supportive interventions used when your acne actually plateaus. So, the key mistake that people make is using procedures to force clearance instead of using them to support stability. So, lasers, for example, lasers are often marketed as a direct acne solution, but clinically, they serve very specific roles. So, some lasers target vascular activity, so helping reduce redness and inflammatory signaling in the skin. So, others are non ablative lasers that calm inflammation and support healing, not by killing acne directly, but by improving how the skin recovers after breakouts. Then we have fractional lasers, which are not acne treatments in the active phase. Their role comes much later once acne is controlled to address things like texture and early scarring. And this is why timing matters because using lasers on unstable acne can sometimes increase irritation and prolong flares instead of resolving them. Then we have chemical peels. What are their clinical roles? So, chemical peels are commonly misunderstood as simple exfoliation, but in acne management, that's not their primary role. So, clinically, peels influence follicular behavior. Example is salicylic acid peels. They're lipophilic, so they penetrate into the pore lining, making them useful when congestion and inflammation coexist. So, their role is not to dry pimples, but to normalize how the follicles shed and drain. Then, on the other hand, we have glycolic and lactic acid pills, which work completely different. So, their role is not clearing active acne, it's improving epidermal turnover and penetration control after acne activity is completely stabilized. So, this distinction is actually very important. So, if pills are used on actively inflamed, unstable acne, they don't improve outcomes, they destabilize the skin further. So, clinically, pills tend to work best after bacterial and inflammatory load has already been reduced. Light therapy, like blue and red light, are often positioned as standalone acne treatments, but in reality, they play a more supportive role. So, with blue light, they can help reduce acne causing bacteria. With red light, on the other hand, it helps calm inflammation and support healing. So, they don't correct follicular dysfunction or long term acne drivers, which is why results are modest when used alone. So, the best role is adjunctive, so supportive healing, while other treatments actually address the underlying acne pattern. Then we have combination approaches. So, this is where advanced acne treatment truly differs from routine based care. So, with combination therapy, it's not about stacking treatments, it's about assigning roles. So, think of it like this: with topicals, it manages the biology, with procedures, they modify behavior and recovery. So, for example, benzoyl peroxide or retinoids. This will reduce bacterial activity and abnormal keratinization. A peel or laser then supports healing, texture normalization, and inflammation resolution. So, if you reverse that order, procedure first, biology later, outcomes become unpredictable. Another overlooked principle is alterations, not overlapping. You don't intensify everything at once. You sequence treatments so the skin adopts without breaking down. And this is why advanced acne care can look slower on paper, but it produces more stable outcomes. Then we have advanced acne management. And this isn't about stronger treatments, it's about systems thinking. So you're balancing inflammation, barrier function, follicular behavior, and recovery capacity. So if you suppress inflammation without supporting recovery, acne will always rebound. If you exfoliate without controlling bacteria, acne persists. If you treat aggressively without rest phases, the skin destabilizes. So, this is why acne often improves briefly, then relapses. So, the clinical goal is not clearance at all cost. The goal is stability first, clearance second. So once acne is stable, treatments work more predictable and stay effective longer. So aesthetic treatments can be powerful tools in acne management, but only when they're used at the right time and for the right pattern and within a structured plan. So, more treatment doesn't mean better results, better sequencing does. So, understanding when acne is ready for intervention is what separates temporary improvement from lasting control.